Hello, everyone, and welcome to the March 24th edition of the Ways and Means meeting. Would you stand and with me and have the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty
and justice
for all. Thank you, everyone. We'll get the usual legalese out of the way. This meeting is being held in full accordance with Governor of Massachusetts' March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 20. If you are interested in attending this meeting by joining the WebEx, you can go to the town website and look on the calendar for the Ways and Means meeting for March 24th. There'll be a link there. Or you can join by phone. The phone number is 408-418-9388. And the meeting number is 179-853-9460. All right, let's get started. I'm not seeing anyone for public participation, but I'll make a call out just in case. Anyone for public participation? Okay, Brad, the floor is yours. Local transportation.
Thank you, Mr. Chair. So we had delayed this since the administration didn't have numbers together just yet. They do now. Tom and I met with Whitney Haskell, our budget analyst, and Marjorie McDonald, who has the honor of overseeing the new local transportation, as if you didn't have enough to do already, Marge. So thank you. So we discussed this item. I think most everybody knows about the new program. We've retired the Beeline. Ridership was toward the end not doing well. So they've now introduced an Uber-like service, and I probably shouldn't be using the word Uber. Again, Marge, I'll learn the correct nomenclature as the years progress. But the plan right now is having an Uber-like service where for the people who qualify for the service, and Marge can speak to how you qualify, you pay $1. You pay the first $1 of the ride, the town pays the next $10, and anything over $11 is on the rider. So in order to cover the up to $10 per ride, there's a request for $50,000 to be raised and appropriated to go to the local transportation revolving fund to cover the cost. Again, running one bus, we were running one Beeline, just as a point of comparison, we were raising and appropriating $80,000. So this is a savings to the town. And again, the usage of this service is increasing and seems to be, at least in the early stages, on track to be a reasonable replacement for the Beeline. Tom and I decided that it was worthwhile to fund the $50,000. And again, that's probably a number we're going to have to adjust as the program stabilizes. But for now, we voted 2-0 to support that $50,000.
Thanks, Brad. Marge, Whitney, would you like to add anything to the commentary, the comments that Brad made? My tongue's tied tonight.
This is Whitney here. I think Brad covered it pretty much on point. The Beeline stopped operating at the end of December. The rideshare subsidy started last February. Kind of sputtered a little bit the first couple months during the pandemic, and we've seen pretty strong growth ever since then. Other than that, I don't think I have anything else to add.
Thanks, Whitney. Questions from the committee? Mr. Eiler.
Thank you, Mr. Chair.
Yeah, just a quick question. I'm curious. I'm looking at the ridership data and it says Lyft rides. Is Lyft being used as a generic term or was Uber really not used at all?
Uber did not bid. We had to do a procurement process, and Uber could not provide the subsidy the way that we wanted to. Lyft was the winning bidder, and then GoGo is the concierge service for Lyft.
Oh, okay. That's interesting. Thank you.
Can you elaborate on what you mean by the concierge service? What's the difference between Lyft and GoGo?
So
can take that.
GoGo, oh, Marge, you can do
I'll
that.
take it, yeah.
Marge.
So, Lyft is just, you download the app onto your phone and you're solely, you're ordering your rides through your cell phone. The GoGo is for folks that don't have cell phones and they need to use a landline, or they don't have a smartphone and they have a flip phone, or they have a landline and they can order the rides using an operator. The concierge service, you can order a ride a week in advance if you need to, and they will track the ride to make sure that the rider gets where they're going, as well as if there's a driver that's not patient and kind and has had a complaint by a senior, they will make sure that they cancel a ride from that driver before it picks anybody up. So they keep an eye on, making sure that they're getting the best service as
Got it.
well.
Thank you. Any other questions? Doug, are you raising your hand?
Yeah. Do we have an idea? I honestly can't remember at this point, but say for February of last year, how many Beeline rides did we get in a month? I know the ridership was poor, but what were we getting per month compared to this?
I don't know that answer. Whitney, do you know it?
I don't have it off the top of my head. I would have to check with John Sanchez on that one. I can get back to you.
Thank you. I should remember. I think it may well have been less than the 208 that you had with this. So I think it's got to be getting close anyway.
Yeah. The other distinction I had is that the Beeline used to pick up anyone who wanted to get the ride, whereas this, I think you have to be of a certain age for the subsidy. Is that correct?
So the subsidy is for anyone who is over 60, disabled, or is under 300% of the federal poverty level. So any age at that, if you're under 300% of the level of the poverty level, you don't have to be 60. You could be 20.
Okay, but for like teenagers or stuff who just want to get around town, they would have to fund it on their own.
Lyft won't pick up, and Lyft and Uber won't pick up anybody under 18.
Okay, I didn't know that. Thanks. Ms. Sickler.
Oh, thank you, Mr. Chair. So, what was my question? Oh, right. So, a revolving account. Why are the funds going into revolving account? Because I find that once things go into revolvers, you lose some sense of tracking and accountability and reporting.
So that's always, we've always done it that way. We raise because it's only partial funding for the entire system, whether it be the Beeline or this pilot program. So we raise some money through the operating budget, and then it gets combined with, at the time with the Beeline, there's the MBTA subsidy. Sometimes there's some grant funding. I believe Marge has some from last year that we're still going to be able to use. And then Beeline fees also went in there. So it's a way to capture all of those different funding sources so that we could pay for the expenses.
But couldn't you capture them otherwise, Whitney? By setting up a transportation line
So,
in someone's
Can I take
budget.
this one? Hi, Eileen.
Hi, John.
Eileen, this is John.
Yeah.
Sorry, I was just getting on. So the only mechanism to actually take receipts and pay them out under the same is a special revenue account, like a revolving account. If we
Okay.
just had a transportation line in the general fund, we wouldn't be able to take the receipts in and then spend them. We would have to actually budget it as a revenue and then budget it as an expense also.
And we don't budget this because it's a guessing game. We don't know until we actually receive it. Is that
Correct.
it?
And there was a lot of different funding sources at one time. I mean, it seems like unfortunately there's only going to be 2 funding sources now, but it's a way to capture the different funding sources.
Okay, all right. Thank you, John.
Yep.
Thank you, Steve.
You're welcome. Any further questions? Chair will entertain a motion.
So moved, Mr. Chairman.
Thank
Second,
you, Sonia. Thank you, Roger. Brad,
Yes.
Cody,
Yes.
David.
Yes.
Is David here?
Yes.
Yes. Doug? Frank?
Yes. Yes.
Thank you. John?
Yes.
Jaya?
Yes.
Kelly?
Yes.
Mike?
Yes.
Bill?
Yes.
Rob?
Yes.
Roger?
yes,
Sonia?
Yes.
Tom?
Yes.
And chair votes yes, 15-0-0. Thank you, Marge. Thank you, Whitney.
Thank you.
Thanks.
Thank you.
Okay, so I lost my agenda. So the next thing is the treasurer collector.
Thank you, Mr. Chairman. This is budget number 145, the treasurer collector's position or budget, 680,445, which represents a 0.99% increase. Last year, the budget was reduced by 45,000, which would have been a negative 5.33% decrease from the year prior. This was Gary's first year with the treasurer's budget, being responsible for it. He was with Brian last year at the end when this was going on, but this was his sole budget. This year, the administrative position that was reduced last year through retirement, Gary is not going to rehire that position for the coming year, which is where you're seeing the reduction. He's also has some changes within a lot of the categories that Brian had. He has taken out the overtime line item, which was just $3,000, but he feels through his management within the department, there's redundancy and no need for the overtime this year. Melt, you'll see a lot of smaller changes between each line items in the melt area, but when you sign up, which was kind of him looking at each line and figuring out what they were going to need overall, there was a reduction of $250. So it's basically level funded in that area. So with the changes of overtime and not hiring the position, the treasurer's position itself that had the increase from where Brian was at, again, the budget is basically just a 0.99% increase. The subcommittee voted 2-0 in favor of supporting.
Thanks, David. Gary, welcome.
thank you.
Do you have anything further you'd like to add to David and Frank's remarks?
Thank you, Mr. Chair. I really don't. David has summed it up pretty well. So, for all intents and purposes, other than the contractual agreements of the employees, it's a level funded budget.
Great. Questions from the committee, Roger?
Just looking at the salary page, in the column for the treasurer collector, there's an entry for longevity or other. Can you further elaborate what is either other or longevity, given that this is your first year? It's not longevity. I can say that. It is basically a stipend. I'm on the advisory board of the Middlesex County Retirement System, so I have to I go to those meetings, which have been virtual, and follow with them. So it's just a stipend along the way. For additional responsibilities. All right. And that was, I assume that was true with Brian, as well. I don't remember the budgets from previous years. Thank you.
Thank you. Thanks, Roger. Any further questions?
Mr. Chairman, motion to approve.
Thank you, Sonia.
Second,
Thank you, Roger. Brad,
Yes.
Cody,
Yeah.
David,
Yes.
Doug,
Yes.
Frank,
Yes.
John,
Yes.
Jaya,
Yes.
Kelly,
Yes.
Mike,
Yes.
Phil,
Yes.
Rob,
Yes.
Roger,
yes,
Sonia,
Yes.
Tom,
Yes.
and Chairman votes aye, 15-0. So now we have the Middlesex retirement accommodated / operating.
Thank you again, Mr. Chairman. Again, did pass around some handouts that you guys should have gotten earlier in the week. This is from Siegel, which kind of gave the breakdown of the numbers, which showed what our contractually bound payment is into the Middlesex retirement system. So the payment 11,757,449, or a 10.13% increase. Again, we're part of the Middlesex Retirement Pension Fund, so we are obligated, and this is a fund that will be fully funded on or about 2035. Just as an FYI, Brian, who had served on the board as treasurer, will continue to serve on the board. I guess is good for Burlington. Subcommittee voted 2-0 in favor of the payment.
Thanks, Gary.
Again, David has summed it up. It's the Middlesex County system breaks down the contribution per town or per community that is involved in the system, and this represents Burlington's share.
Thanks. Any questions from the committee? John,
Thank you, Mr. Chair. Yeah, Gary, there's something maybe I didn't realize previously. The amount that we're paying in is entirely based on our own town's employees and experience and so on. There's no sharing across the county.
There is the funds are commingled into one fund, but the actual payments are identified through the retirement system, through their record keeping as to what our liability is.
Okay, great, thank you.
is that audited and kept? How is that kept up to date and audited? Like to ensure that it's kept up over time.
Well, again, Siegel performs their review. I have not seen the audit report, but I would venture to guess it would be, I can speak in the affirmative that this fund would be audited.
Sure. Okay. Thanks. Phil, I couldn't tell if you had Tom, I couldn't tell whether you had a question or not.
No, I'm all set. Thank you.
Okay. Any further questions? Chair will entertain a motion.
Motion to approve?
Thanks, John.
second,
Thanks, Roger. Brad,
Yes.
Cody,
Yes.
David,
Yes.
oh, sorry, Doug, you're muted, but I heard yes. Frank,
Yes.
John,
Yes.
Jaya,
Yes.
Kelly,
Yes.
Mike,
Yes.
Phil,
Yes.
Rob,
Yes.
Roger,
yes,
Sonia,
Yes.
Tom,
Yes.
and chair votes aye, 15-0. Pension fund, David?
Well, we've seen this for many years. It's a small number. It represented a dual pension, a veteran that had retired from multiple systems, and we were paying. I believe it was the Swampscott, but I don't remember.
Yeah, it was like $1,250.
It was 3,000. It used, it was a little higher, but again, for the last couple of years, we have not been billed for it. So we're assuming that the obligation is no longer an obligation. So we've budgeted 0 in the line item. We supported it, but there is no funding here. So I'm
So
not
we don't
sure if
need
we
a-
need to. I don't
Yeah,
think
we
we
don't
need to
need a
take a vote.
vote, right? Not for $0. Health, so we'll move on to health insurance.
So, so again, it's sent around Gary's spreadsheet on how this is put together. In effect, it's a little different, but similar as Brian had put together, kind of an outline. And I'm going to kind of talk in the big picture sense. There may be specific questions with the spreadsheet, and I'll let either Frank address that, or we may call on Gary if he has specifics. But health insurance line item is 15,028,422, or an increase of 5.66%. We did have a reduction last year out of the budget for 250,000, or it would have been a 3.84% increase had that not been done. The funds are this funds our health insurance and employee benefit program. It's a collaboration with the town and the union representatives. So again, ultimately, Gary walked us through each line item, looking at the costs of the Pilgrim and the Blue Cross programs, the overall cost, claim history, the different line items that we have for certain programs that we have, administrative costs, stop loss provisions, again, because we self-insure. So we've got that in place. So again, I'll let Gary get into the specifics, but again, it's detailed on the sheet how it's there. The town funds 70% of those insurance costs. Employees pay 30%, and the fund right now has a balance of about $10 million. That's a good, healthy balance to have in the account. And right now it looks like we're working almost at a break even, meaning what we're putting into the fund to pay for the premiums and the costs are breaking even. People that have been on the committee for a number of years will remember a while ago we weren't doing that, and it got to the point where the town actually had to fund some reserve into this so that it doesn't go too low. So we right now have a good balance. It's keeping pace with claims, and for now, there's no recommendation as far as to do anything with that fund. We had at one point when we returned some of the funds to the town, we had a joint effort between the unions and the town to put money back into the OPEB fund as a special payment, but no recommendation is being made for that right now. Again, the subcommittee voted 2-0 to support it. Again, overall, the big picture, health insurance costs and costs that ultimately work out to a modest increase. We think that everyone's doing a very good job. So again, we voted 2-0 to support the health insurance line item. I'm not sure if Frank has some specific things that he'd like to talk about here as well.
If I
that's
may,
right.
Yeah,
Steve,
go ahead, Frank.
what I'd like to do actually is ask Gary if he would like to comment on his own. There are a lot of moving parts here, and he's done a lot of work to understand this, really understand it, put his own hand on it in terms of what, if anything, should be moved around. And not much actually has changed at all. But Gary, if you'd like to make any comments, I think it's up to you.
Yeah, if I
Gary.
may, Mr. Chair, thank you.
You may.
I want to thank the subcommittee. We did spend a lot of time on this line item. The premiums are based on a calendar year, and we're in a fiscal year. So what I did for the 2022 fiscal year 22 budget, I took the first 6 months based on the calendar year, because we know what the premium cost, the estimated premium costs. We know the withholding amount from the employees. The second 6 months, we added in a 3% increase. So the line item you see on the first highlight, monthly charges, active employees funding, that's the charges that we're funding for active employees is 7% of the town. As you move down, the administrative charges, although we're self-funded, Blue Cross and Harvard Pilgrim Health monitor the claims. So on a monthly basis, we get a report from the actual claims, and we send them a base amount each month. They deduct the actual claims that they've paid off of that number, in each quarter we reconcile. If we have a reimbursement coming back from them based on our payments, we get that back. If we have an overage, we have to make that payment to them. With the HSA plan that was introduced in 2020, where we presently have 36 people on that. The health savings account, we are responsible for contributing $1,500 for each individual, $3,000 for a family, which represents half the deductible put into a savings account for the individuals. The results of this type of plan is a lower, the higher deductible of $3,000, $6,000 is a lower premium, which creates savings for the town for the difference in that premium for what we had. And I put that in. That is a responsibility for what the town has to contribute for those plans. For the reimbursements of the HMOs, the first $1,500 for individuals, first $1,000. It's not a savings type account. When a participant has a claim, the town will contribute up to $500 towards any payment they make, or for a family, $1,000. So this past year, as it looks, fiscal year, it was 638. With an increase, it came to $11,000. That's 700. Excuse me, amount of dollars. Well, no, I'm down the wrong line item. Excuse me. 278 for and 128 for both the individuals and the families. This past year, 2020, we paid 396. So that's a small negligible increase for what we think the claims are going to be. It's been a difficult year for claims, as one would expect during the height of the pandemic in March, April, May. In June, the claims were significantly lower. We saw an increase July, August, September. They tended to level off at a certain level. In December, they were low, or January, I would say they were lower than an average. The interesting aspect of this also, with people wearing the masks and people not going out, we're having less smaller incidents, flu-like claims or respiratory, other than outside of COVID. On the flip side, we seem to be having, unfortunately, some larger claims for people from a health standpoint. That brings, I'm going to jump down and talk about that, then I'll go back up to the retired employees. The stop loss premium, any claim, we have a number of $125,000 that once a claim goes over that, we get reimbursed by a provider. The cost we pay for that is $1,257,000. We expect reimbursement of $735,000 this current year. In January, we received a refund or a return for a claim of $128,000. And we're in looking at the claimants, or again, those cases, we seem to be, we have a large amount right now. But we're covered again by the $125,000, and we'll get reimbursed for anything past that. I'm going to jump back to the middle where it says retired employees on the program. Again, a small increase from what we had for January 2021. And the retiree premium repayment, you can see that that has increased probably 50, 60, $80,000. We're seeing, we got about a 16, if you, for the members who have been around for a while, some of the programs have a 10% for the retiree contribution, some have a 20, some have a 30. And that was based on when they started. And along the way, the board has changed the participation rate. In 2021, or the last fiscal year, we averaged about 16%. We're noticing that, and that was an increase of a few percent over the prior year. So in 2022, I'm estimating a higher percentage. And had that conversation this morning with CEO as we're doing an actuarial study for OPED. And he concurred that he sees that in some of the numbers that are happening now, the people that are remaining as retirees. I'm going to go down further, and I'm sorry I didn't stay on track here. Diabetes program is something, it's a benefit for our employees. We have a good that we deal with. It saves on medications, saves on prescriptions. We get some rebates along the way for the cost, but it really keeps the members, participants who have diabetes, excuse me, will help them along the way education-wise and tracks them. And that we hope will result, and it has resulted in less claims along the year for those individuals. We have a member rate of about 63% of the people that have diabetes of our participants are here, which is higher than the company's national average. And so they're very happy about that. And they're sending out another notice to all the participants. We actually have 747 active participants in our health program. Canada, our prescriptions from Canada are another thing where we save, the participants save some money if they get the prescriptions from Canada. That's just an average, that's an administrative charge, $7,200. Flex spending and childcare, people contribute the money to the flex spending. They have, given COVID, they've extended the period of time. So even from 2021 for 2020, money that they set aside, they can spend that through the end of the year. So those are our actual costs for administrating the program. Life insurance, it stayed flat. It's a standard number. I just used $36,000. And we have a health insurance consultant, Gallagher, who helps us along the way for the stop loss, does a lot of work in the premiums. For the stop loss, they did a lot of work as we put it out for bid again, as we do every year. And that's a $2,500 a month. Came to the total of $15,028,422, a little higher than our assistant town administrator wanted me to come in at, but the numbers proved out, and I think it's a strong budget for the next fiscal year. Take any questions, Mr. Chair?
Mr. Chair, I do have a question. This is Cal. Oh, but Frank raised his hand first, like the good.
No, go ahead. Steve,
So, thank you, Frank. So, in my past life, I was an insurance agent, although not healthcare insurance, as Gary knows. When you say we put this out to bid every year, are we putting it out to bid to different insurance carriers, or are we foregoing the $30,000 cost for our consultant and going to different agents and looking at different plan types than straight healthcare?
We're looking at straight healthcare. So Harvard, Pilgrim Health, and Blue Cross. We're very active in putting it out to bid was in our stop loss program. We probably got 30 different proposals for We did not change this year at all on the type of health, the type of insurance we offer. We're in HMOs, and we're hoping that more people migrate over to Harvard Pilgrim Health for the savings plan. So I may have overspoken saying we put everything out to bid. We did not, it was really the stop loss that we were very active.
Okay. Thank you, Gary.
You're welcome.
Steve?
I think you're muted, Steve.
Apologies. Did you want to add something, Frank?
Yes, just briefly. So many of the committee members have heard, this story time and time again. And for people that are new, there are a lot of moving parts here. From at least from my point of view as a subcommittee person, this program is only worth doing if we provide really good plans. So our plan designs are good health insurance, and we're saving money, and it's affordable. You have to hit all those buttons. And I think we've done quite well with this for a number of years, and I think we're doing even a little bit better than I would have expected. And I'm pretty happy with the results. We did raise the stop loss deductible to get that premium down because it's pretty expensive, and we have no choice but to carry that insurance because it doesn't take too many things to go wrong to really put you into a pretty big cost hole without it. I think we did the right thing by taking more risk, maintaining top shelf stop loss insurance, and we need it. We have to have it. I also think that there's been a lot of effort put in to use high deductible incentives and to use wellness programs, especially the diabetes program. And it's pretty hard to measure how much good that's doing, but we're experiencing really good behavior from our participants. I think our employee base is really well below national costs, and they continue to I think show us that this is an affordable program with modest increases. So I'm pretty pleased with it. I think if at any point in time this committee or any other, active group thought that we could do better by doing something very different, we would. We're doing this because we think it works really well. The last thing I'd add is on the trust fund. So I think most of you know it, but the way this works is you set your premiums, you garnish the wages, and the town makes its contribution, and we fuel the trust fund on a regular basis. As the bills come in, we debit the trust fund and we pay out of it. And so you've got a fixed input. Your fixed input is what you set the premiums at, and you've got a very variable and potentially unknown output, which is your costs. And so we've seen times when this has gotten pretty dicey, and we've seen times when it's quite healthy. That ebb and flow is hard to completely explain, but I think it's the natural course of events in the aging process of our clients, just how things, the draw of the dice in any particular year or set of years. As David pointed out, and that fund is earning fairly well. So we have a $10 million positive balance, which would suggest that if we had, did nothing but take premiums and pay bills, would probably be okay. But the committee and the administration talked about at length whether we should leave that larger balance in place, because we could do other things with that money. And 70% of it is ours, is the taxpayers. We in the discussion, we concluded that given a $15 million swing and a $10 million cushion, you could hit one or two bad years and you could very easily eat up a lot of that $10 million. So we've elected to leave that level alone, completely alone. and see how it does. And if it stays there, I think we probably would continue to leave it alone. If it were to get significantly higher, then we can have discussions about redistribution. And there are many options on that, not worth getting into here. But that's an asset that is our safety net. And we seem to be in a really good position. I'm also very happy with the increase. Gary, I think projected a 3% increase on the premiums would be sufficient. And I think that's it's not a big number. And I think based on what we know, it looks pretty safe. And given that we've got a balance to work off of if we get it wrong, and we have advice from our consultants as well, I think that was a very good tone to strike. And I don't know, I don't know why Paul and John are unhappy with how big the bill is, but I actually think it's a pretty good number considering all the things involved in this program. So that's my 2 cents worth. Thank you.
Thank you, and Mr. Chair, if I may, I want to be clear on the active employees that the participants pay 30% of the premium and the town pays 70. There was some discussion a while back thinking that we had a very rich health care program. I found that to be the norm in industry, unless that's changed in the last 2 or 3 years. I think that is pretty standard along the way.
Thank you, Gary. Any questions from the committee?
Steve,
I've heard Mike, I see John's hand, and I know David or Doug wants to ask a question. So go ahead, Mike.
thanks. So I heard mention of some different programs, Gary. I'm just wondering, are we still doing any lifestyle type of programs for people?
Yeah, we're very active, and thanks for asking that question. We're very active in wellness programs. The HR department, Human Resources, and Christine Sinicola and our benefits group, part of the Treasurer Collector's Office, is very active in producing different materials to individuals. Every week, Joanne Faust sends out something from a wellness standpoint. That could be a simple thing as some recipes of different types, but really talking about that. We had unfortunately this year we had a virtual health fair, last year I should say. And we're planning, hopefully if things move ahead, to have a live one for some of the employees, maybe a smaller crowd, but different aspects, things that will help people along the way.
Oh, okay, but there's nothing like a rewards-based thing like sign up and track your physical activity and you'll get $100 back or something like that.
We had a discussion about that, and in fact there's a wellness fair that's going to talk about that Joanne invited me to, and Christine is going to go to virtual. I think it's April 24th, somewhere in that vicinity. So we're going to listen to some of the programs. I've done that in the past with smoking and weight. The smoking one was quite helpful.
Yeah.
And we have an insurance committee, which is made up some of the employees from the town who are very helpful. And we did talk about revitalizing or starting some programs in the next fiscal year, not this one.
Yeah, so
associated with, so.
we have things like that at work, and they change a little every year, but you can get like a device like a Fitbit if you do the program, and it just kind of like sort of feeds on itself a little bit. You do exercise, and then you get a device that helps you stay with that exercise, and I like it, but it depends.
Yes.
Yeah, worth looking into. Okay, thank you.
Okay, John, and then Doug.
Thank you, Mr. Chair. Yeah, it's great that we have the stop loss on the health insurance, and I see we have an excess liability policy. And what I'm wondering is, for our other self-insured areas, are there any uncapped liabilities that aren't insured? So for instance, workers' comp is another one, I guess. So are there any uncapped liabilities?
Gary?
Well, not in the health area, there is not. The stop loss would take care of that.
I'm asking sort of across the board. I realize we're on health, but just in terms of anything that we're self-insuring.
The unemployment, that has a certain amount of time. We're self-employed and unemployment also, so that would have a time certain, and that's based on formulas of salary, and so that would not be uncapped. Workman's comp, I'm not
Hey,
as
Gary, I can step in if you want. This is John.
Yeah, go ahead, John.
Yeah, those are the two, the unemployment and workers' comp. We don't have any insurance to cap those or stop loss type insurance. Those would be uncapped.
Okay. Is there anything outside of those that would be uncapped, or does that cover all the things we're self-insuring?
I can't think of anything.
No, that's it.
Okay. All right. Good to know things won't explode. Thank you.
They may explode, but their liability won't be too bad. Doug?
I think, well, I don't care who answers, but I think it's for Frank. And it's a little bit of a combination of an OPEB question and a health insurance question. So we have this $10 million that we could probably spin down a little bit, but I agree with keeping it where it's at. I totally understand that. If we were to, at some point when things stabilize, if we were to spend some money from that toward OPEB, it's my understanding, and I think it's just because it's just on the retirement side, but if we had to, we could take money out of OPEB and put it back into this health insurance fund to at least cover retiree benefits. So it'd almost be a way to front end fund OPEB more, but then if we needed to, if we overdid it, we could take it back and put it back in at least the retiree side. Is that true?
Is Paul on the call, John?
Yeah,
Yes.
Paul is here.
We've never discussed going in that direction. I tend to think it's not a good idea, and I'll tell you why, and then I'll leave it to Paul and John. The OPEB program, it's a closed time frame. It was set up for a 30-year time frame. We'll be doing well to have that fully funded in the 30 years. So first of all, you're looking at a long horizon before I think anybody in their right mind would move money from the OPEB trust.
No, that would, I'm sorry, maybe I wasn't clear, Frank. So I agree with you. I was saying we could front load OPEB more if we were to spend down this 10 million. Say you put $1 million into OPEB from this health insurance fund, and then in 2 years we're like, oh wow, we need to put some money back into the reserve, the health insurance reserve fund. Could it come back out of OPEB because they're both health insurance? And then we wouldn't be losing. You would have maybe gained some.
Yeah, I don't know the answer to that. Sorry.
Paul or John, do you know?
Well, if I can, Mr. Chairman, the health insurance trust fund is a combination of the town and the employees' money. And again, many towns have almost gone bankrupt over their municipal self-insured trust funds. And one of the things that we've always done was to make sure that we had that safety net there and to make sure that we properly funded it every year. So is there a proper balance where, the health insurance trust fund backstop sort of gets to be too large? Absolutely. I do think that in order to move that money out of there, it would require a conversation with our collective bargaining groups just to make sure that they were in favor of reallocating some of this money over to OPEB. I mean, it is a possibility, but like I say, it's evaluating that balance, and we've been very fortunate through very tight management of health insurance to have some very good claims history. But one thing that we've learned over time, and other communities have learned the hard way, is it can turn around really quickly on us, and that money could evaporate pretty rapidly. And I think we even experienced it here. I don't know, it's got to be going back to 7 or 8 years ago now, where we had to ask town meeting to provide some funding for the health insurance trust fund just to ensure that we had the liquidity to be able to handle the claims, because it had been worked its way almost all the way down down to zero at that point in time.
Thank you, Paul.
So, Steve, I won't belabor this. Can I just, I don't want to shoot the messenger, Doug. The idea isn't, it's not insane. What you're really driving at is, could we use other funds, and available health insurance money could be a source to essentially superfund OPEB. And if we needed to pull some of that money back from OPEB back to the other insurance plan, health plan, could we? My thinking on this is, we're going to talk about OPEB in more detail. Maybe someday that will become viable, but the way to keep the 32B plan from getting too fat is simply to do a distribution or slow down the premiums and eat into it. And that immediately saves you money on your operating budget. Now, there are many ways to get that down. And if what we really are trying to do is superfund OPEB, I think we should look more towards free cash or more towards raising the line item, making the OPEB line item have a different profile. Currently, the OPEB line item is, if you think of derivatives, it's level funded. It's 9-point-something% a year for the next 20 years. What you could do is change the shape of the funding of OPEB and make the next 5 years 15% and fund it. And then in the back years, instead of being stuck with 9%, you get a lower number and you get those huge payments out of the back end. I mean, if you're trying to superfund OPEB, we should analyze that problem in and of itself. And I think we will have that discussion over the course of the next year. We're going to get another actuarial report. We're going to get a sense of, what the back years are going to look like. And we could think about getting monies to pour into OPEB at some point. And the 32B plan could be a source, but I wouldn't just jump to that at this point.
Thanks, Frank. I saw Roger and then David, unless David's really quick.
Yeah, I just wanted to point out Paul's comment that, again, understand this is a joint account with the employees. So anything that we would do with these funds would have to be agreed on by the unions. So whether that's throwing extra money in OPEB, or quite frankly slowing the premium increases, help current employees immediately. I mean, there are different negotiations that would have to be done, and whether what our goal may be in the long run, and helping in that long run goal may not be what the unions are thinking right now for the short term.
So we'll
That's
have,
a good question.
yeah, we'll have that OPEB actuary report, I think, sometime early fall. So that'll be something definitely on our radar. Roger, sorry.
I guess a two-part question. So what have been the trust fund balances for the last, say, 3 years, just to make it easy? Current one's 10. What was it the last 2 years?
I don't have that.
I can get it for you, Gary. Give me a second.
Thanks, John.
I guess where I'm heading here is it seems like it's been growing, because as was mentioned, some 7 or 8 years ago, we were down to like $1 million and we had to backfill it. If it's growing, $1 million or something every year, then it seems like we're overfunding the contributions, both from the town and from the employees. And I would think that they would appreciate having a little bit of savings, especially, in this sort of several year period where money is tight for a lot of people, including the town. So I guess I would have looked harder at, should we have reduced, shift a little bit of the burden from new payments into that trust fund versus just being able to let the fund come down. I know Frank has already sort of given us the story on that, and I appreciate that. I just didn't want to be completely silent and accept it. So John, did you find those numbers?
Well, let me answer, John, I'll answer the second part of your question. John.
Go ahead, Gary.
The second part of the question, this budget is as close to, I think, break even as possible. And when we met with the insurance advisory committee, that's what we discussed going forward for the current fiscal year, the current calendar year for 21. So we're not looking that this balance will increase by any large amount. And in 2020, I think most of the increase was related to investment versus contribution.
Well, I think my point is that the fund is already over where it needs to be, and you should have aimed for something that was less than break even. Anyway, that's my 2 cents on that. Funding both the health insurance plan, because we are able to invest it, and OPEB, which I know we'll talk about later, I think is important because of compounded growth. So one versus the other, you got to balance them out, and that's already been said. Anyway, I guess my only remaining piece is what were the balances for the last couple of years in the trust fund?
John?
Yeah, so I just want to check those and get back to you if you don't mind on that. It was it looked consistent about 600 and something thousand. And then from 18 to 19, it grew much larger than that. So I just want to make sure.
Okay, well, I mean, I appreciate that people are being healthier under tough situations.
And I will say we have conversations with the union when we set the rates. They're involved in the conversation and how much we should go up on the rates. There's a recommendation, and then we sort of say, okay, if the recommendation was to go up on the premiums, 6-7%, and we settle somewhere around the 3 or 4 range. We know we're going to be eating into that a little bit, and or potentially eating into that a little bit. But we, like Gary has mentioned before, we've had a great run rate with claims.
Okay. All right, thanks.
Thanks, Roger. Gary, what can we do to encourage more people to get on the high deductible health savings plan? How much does the town realize in savings from that?
I'm going to estimate we'll save about $50,000 in the next year.
For the 36 people that are currently on it, that would be what the savings to the town is?
Yes.
Okay. So 36, I thought, represented about 5% of the employees who are participating. Is that right? Because there was 600 and something.
Yeah.
Okay, so approximately 5%. So it seems like there's a lot of opportunity to try and get more people onto that kind of a plan.
I think some of it's education. We went from 33 to 36. There was a small increase, but I think as people start talking about their health savings account, I think what turns some people off, Mr. Chair, is the deductible of 3 and 6. If they can think about the fact really the deductible is $1,500 and $3,000. And if we had a live health fair alongside with our wellness fair, if we had actual people, I think we would have gotten more people joining it, because we would have had people from Harvard Pilgrim Health talking to people. We had people doing it virtually, but it doesn't equate to the same.
So then after the first 1,500 or 3,000, if it's a family, what is the breakdown in terms of what they pay afterwards? Is that just regular coverage or?
Yes.
Okay. Great. Any other questions? Thank you, Gary.
Welcome.
Seeing none, the chair will entertain a motion.
So moved, Mr. Chairman.
Thank you, Sonia.
Second.
Thanks, John. Brad.
Yes.
Cody.
Yes.
David.
Yes.
Doug. Was that a yes? Okay. Frank.
Yes.
John.
Yes.
Jaya.
Yes.
Kelly.
Yes.
Mike.
Yes.
Phil.
Yes.
Rob.
Yes.
Roger.
Yes.
Sonia.
Yes.
Tom? Tom? I
Muted.
can't hear you.
I apologize. Yes.
Thank you, Tom. And chair votes aye, 15-0. Unemployment.
If you don't mind, we'll just jump into the central administration, the central machine and central administration.
Sure.
Number 149. So most of the line items in this budget, again, are the accommodated accounts. There are two line items that typically we vote individually, central supply and central machine. We'll take central supply, 110,000 level funded. Again, sent around a list that Whitney had put together. These are your excise tax mailings, your real estate bills, postage, and general office supplies. So this has been level funded for as long as I think I've been on the committee. The subcommittee voted 2-0 to support that line item.
Thanks, David. Is there additional commentary from John or Whitney? Probably not. No.
No comments, Mr. Chair. David
Okay.
summed it up perfectly.
Thank you. All right. Any discussion? Chair will entertain a motion.
So moved.
Thank you, Mike. I think that was
Second.
Mike. Second. Was that you, Mike?
That was Phil.
Oh, sorry. Sorry, Phil. Okay, Brad.
Yes.
Cody.
Yes.
David.
Yes.
Doug.
Yes.
Frank.
Yes.
John.
Yes.
Jaya.
Yes.
Kelly.
Yes.
Mike.
Yes.
Phil.
Yes.
Rob.
Yes.
Roger.
Yes.
Sonia.
Yes.
Tom.
Yes.
And chair votes aye, 15-0. Central maintenance.
Central machines. would be
Sorry.
Next, that's 26,500 level funded. A number of years ago, we brought the copiers used to all be part of individual budgets. We brought them all into one. So this is the town side copiers and postage machines. We have 26 machines. As you see from the list, most of them are now owned. We do have a couple of lease payments. The library pays theirs out of their own budget, but most of them are owned. So it includes that lease payments and the umbrella policy for the use. Subcommittee voted 2-0 in favor.
Thanks. Whitney, anything to add?
No comments again, Mr. Chair. David summed it up perfectly.
Thanks, Whitney. Any discussion? Chair will entertain a motion.
So moved.
Thank you. Second.
Second.
Thanks, John. Brad.
Yes.
Cody.
Yes.
David.
Yes.
Doug.
Yes.
Frank.
Yes.
John.
Yes.
Jaya.
Yes.
Kelly.
Yes.
Mike.
Yes.
Phil.
Yes.
Rob.
Yes.
Roger.
Yes.
Sonia.
Yes.
Tom.
Yes.
And chair votes aye, 15-0. Okay, unemployment.
Unemployment, 100,000 level funded. Again, this is a very difficult budget to predict. It covers all town and school unemployment claims. As we just mentioned earlier, this is a self-funded account. So all you can really do is kind of make sure that you have what you think is an adequate portion in that budget for those claims. So 5-year average in payments out of this account has been 71,000, and a 10-year average has been 87. So still below the 100, but we felt 100 is still a comfortable number to keep as a line item. Subcommittee voted 2-0 in favor.
Thanks, David. John or Whitney? Any additional comments?
If I may, Mr. Chair.
Sure, Gary. Oh, did I call the wrong person? I'm sorry.
No, no, we're all involved in the different aspects of it. I just have been probably a little closer recently as as the problem existing nationwide with the fraud and unemployment claims. The town has been actively looking to make sure that these fraudulent claims are not hitting our books. John was the first person that brought something to my attention early on when I started in July. And so we do have a group that monitors it for us. And we've had a lot of false claims. A few got paid. We have a credit balance right now, so we're getting some refunds back from the state, and we're on top of it. So we were not immune from what happened to a lot of different companies in municipalities across the country.
Thanks for being vigilant about it. Any further discussion? Chair will entertain a motion.
Motion to approve?
Second.
Thank you, John. I heard a second. Brad,
Yes.
Cody,
Yes.
David,
Yes.
Doug,
Yes.
Frank,
Yes.
John,
Yes.
Jaya,
Yes.
Kelly,
Yes.
Mike,
Yes.
Phil,
Yes.
Rob,
Yes.
Roger,
Yes.
Sonia,
Yes.
Tom,
Yes.
and chair votes aye, 15-0. Medicare,
Medicare, 1,260,128, or a 5% increase. This is the town's portion of the Medicare tax. So all employees that were hired after 1986, we pay into this Medicare tax plan. Been steadily increasing as older employees that didn't pay into the system retire and are replaced by newer ones. But it's solely based on the payroll levels that we have. Subcommittee voted 2-0 to support.
thank you. Whitney or John?
No comments, Mr. Chair.
Thank you. Discussion, motion.
Motion to approve.
Thank you, Tom.
Second?
Thanks, John. Okay, Brad,
Yes.
Cody,
Yes.
David,
Yes.
Doug,
Yes.
Frank,
Yes.
John,
Yes.
Jaya,
Yes.
Kelly,
Yes.
Mike,
Yes.
Phil,
Yes.
Rob,
Yes.
Roger,
Yes.
Anya,
Yes.
Tom,
Yes.
chair votes aye, 15-0. Town insurance,
Town insurance, 1,156,399. That is an increase of 4.53%. This funds all the town and school properties, includes casualty, auto, professional liability, workers' comp, which is again a self-insured program. Does not include workers' comp on the police or the fire, which those are separate. Those individual budgets, which we have meet with them. We've had a tougher claims history over the past few years, which has affected some ratings. And so we've had to raise our deductible levels and take on a little added risk in order to keep this number in check as best we can. We do have a consultant which overviews this and makes recommendations to the town as we monitor it. Whitney had sent together a breakdown kind of in each budget area and what's included in each budget area. The subcommittee voted 2-0 to support the budget.
Thank you, David. Whitney, anything to add?
Yeah, I think just on this one, as David said, we have had a bit of a bad claim history that's sort of impacted our budgeting, but we are taking a much closer look at that now and exploring, researching the claims, and if we're having repeat injuries, say, or repeat incidents, how we can attack that. So we're really working with our third-party administrator to develop a plan that hopefully in the long term will help us get some of these costs under control. Thank you.
Thank you. Discussion. Motion.
Motion to approve?
Thank you, John.
Second.
Do I have a second?
This is Frank, second.
Thank you. Brad,
Yes.
Cody,
Yes.
David,
Yes.
Doug,
Yes.
Frank, John, Jaya,
Yes.
Kelly,
Yes.
Mike,
Yes.
Phil,
Yes.
Rob,
Yes.
Roger,
Yes.
Sonia,
Yes.
Tom.
Yes.
Chair votes aye, 15-0. Audit.
Audit is, excuse me. It's the audit is 60,000, which is, I guess, level funded with the reduction that we had made last year. This basically covers our annual, town audit that Sullivan and Powers undertake. In 2019, we had increased this to 80,000 with the hopes of continuing that to do some specialized audits like we've done in the past. Did it for the lunch program. We did it for the school at the time a number of years ago, as you remember. But for this year, we kept it level at the 60,000, which is just for the town audit. The hopes will be to continue to do some specialized audits when they're needed or they come up. So we may be looking next year at increasing this back to where we had put it. So subcommittee voted 2-0 to support.
Thank you, David. Whitney, anything else to add?
No comments, Mr. Chair.
Thank you. Discussion and or motion?
Motion to approve?
Thank you, John.
Second, Mr. Chairman.
Thank you, Sonia. Brad,
Yes.
Cody,
Yes.
David,
Yes.
Doug,
Yes.
Frank,
Yes. Yes.
John,
Yes.
Jaya,
Yes.
Kelly,
Yes.
Mike,
Yep.
Phil,
Yes.
Rob,
Yes.
Roger,
Yes.
Sonia,
Yes.
Tom.
Yes.
Chair votes aye, 15-0. OPEB.
Pep, I can start the discussion. Frank may want to jump in this if you got, but let me at least do it up. So the OPEB, again, as a lot of you know, we had kind of put together a schedule for having this thing funded, which called for a 9.3% increase each year. Siegel puts together their actuarial studies every 2 years, which is required, and they're in the midst of that right now. That is going to be available probably in the fall time. So right now, if you looked at the schedule from when we originally had put that together, it called for a payment of this year of 852, 493,000. So that's the number that we're putting in for, and it may address this when the budget season is over. But for now, we would fully intend to make that payment from the operating budget. Because of the large increase you see of 712%, this was obviously a line item that was greatly reduced last fall with the pandemic. We had been slated for a payment of 779,957. We did make a payment of 104,951 into the account, but we reduced the account, the remaining 675, and did not fund for reasons discussed last year. So this does represent the full payment based on our payment schedule. We'll probably have some other discussions with our free cash in whether or not we may want to make any additional makeups from last year. Because again, this is, as we've discussed, a compounding event that the more money you get in, the earlier you get it in, the better we're off as a whole. I mean, the liability, how much is there? We'll get another actuarial study this year, but it's a big number. It's a responsibility of ours. The more, the faster we get the money in there, the more it's going to earn over time. So we have these monies invested. We have the ability to invest these funds, unlike other town accounts, and the account's been making a good return. We utilize the print fund, which is the same as the retirement system. Right now, and again, Frank may want to discuss a little, the subcommittee did vote 2-0 to support the payment, provided that when all is said and done, we're comfortable in where our percentage increases are coming in, that we can fund this through that operation. So may be addressed again, but for right now, the placeholder and what we had in the schedule when we put that together a number of years ago, we'd like to continue. So subcommittee with 2-0 in favor.
Thanks, David. Frank, did you want to add anything?
I think only if the committee wants discussion on this. I think everybody understands it. I mean, I could say a lot. I wasn't bothered by only putting in 104K in the current fiscal year and down funding it, because in my opinion, it's more prudent to hang on to our free cash than to worry about what will probably turn out to be not too bad a tick in the OPEB plan as we know it. And I also think when we get the 2-year actuarial report, it's too hard to guess, but earnings have been good. And I think then we can just assess what we want to do going forward. And I think it's good that we're making the full payment this year. I actually didn't think we'd be able to. I think the administration came up with some money and put it towards this, which is very appreciated. And as David said, if we have trouble with the scorecard and we're starting to project an overall levy increase that goes outside of the 5% max, then we'll have to revisit this. This would be a key place to, pick up some money if we had to. So, but we did support it. Thank you.
Thanks. And Gary, did you want to add anything, or?
I guess we can, take any questions, but I think, again, David and Frank have stated some of the particulars.
Okay, cool. Bill?
Yeah, Mr. Chairman, thank you. A question for Mr. Sagarino. Did I read correctly that we're getting $2.5 million? And what is your plan for that? And how might it affect this budget or others?
Phil, you know something I don't know about? We are expecting to receive some funding from the federal aid package. In discussing it with John, we haven't really been provided with any specifics on what we're able to use that for. We don't think that we'll have specific enough information for May, but possibly by the September town meeting, we may have a better understanding as to how we can utilize that to impact our budget.
But it is $2.5 million?
Well, it's actually on a listing that we got, it's 8.8 million. But again, is that direct aid that we can do whatever we want with? Not likely. It's probably tied to different programs. different functions or different things that the federal government would like to accomplish with the money. So we will potentially have access to that amount. What we don't know is what we'll be able to use it for or what different programs. They're boosting a lot of their typical programs, say Assistance to Firefighters program. That's really only relevant to us if we were adding firefighters in this particular year. So we'll have to parse through it. It's a very complicated document. We haven't gotten any clear guidance whatsoever. John has mentioned in the past revenue replacement. We are told that there is a revenue replacement aspect to it. That is something that will be beneficial to the town if we can get some clarity on that. But we're not anticipating that we'll have anything that will be able to drastically impact at least the budget by May. But again, we can continue to make decisions as the information becomes available as to what type of updates or changes to the budget we can make in September to utilize that funding.
Thank you, Mr. Sagarino. Thank you, Mr. Chairman.
Thank you, Phil. Any further discussion?
Yeah, I had a question, Steve.
Go ahead, Mike.
Thank you. So looking at the projection document, it's very linear and it because it assumes, and I guess it's built around an assumption of a return of 7.25% per year, I guess from the PRIM fund. I think I heard that. But that will obviously vary year to year, so the numbers can change quite a bit. Just curious, how has the return been the last couple of years in that fund?
If I may, Mr. Chair, I can tell you this year to date, we're averaging around 16%, but which is beating some of the benchmarks. Let me see if I can get a I'm just trying to look at the quarterly reports, see if I see anything from the prior year. I don't. I don't have something beyond the 6 months for the calendar year. I think it was around 12.
Okay, well, that's good.
No, they bounced back, and unlike, this is a managed investment, as people know, and they deal in billions of dollars, and the state use them. They're a good board. I've been to virtually with one of the meetings. I've been in touch with some of their people and quite comfortable with them.
Okay, good. Glad to hear that.
All set, Mike?
I am all set.
Mr. Eiler?
Thank you, Mr. Chair. Just a particularly timely question, Mike, just because I happened to be doing this morning. I did a little calculation on the internal rate of return based on all our contributions and the current balance in there. And so we've been putting things in our contributions in since 2013. And the rate of return compounded over that period of time is 8.8% overall. That, of course, can change, as things happen, but that's what we're experiencing as a compounded growth rate currently.
Mr. Sagarino?
Mr. Chairman, if I could, John, and I may have to go back and check on this, but I am fairly certain that in the infancy of funding OPED, I'm pretty sure that we weren't invested in that way. So the beginning years of OPEB, we may have just been more invested in cash at the time while we were trying to determine how to invest the money. So the money definitely was, as far as I recall, was not invested in the PRIT fund from the beginning. The state had to sort of change the law around to allow cities and towns to utilize that fund for OPEB. So I'd have to go back and check on that, but that could be a possibility as well.
If I do have the
Go ahead, Gary.
town meeting voted to establish OPEB in May of 2010. On June 24th of 2013, the town had decided to enter into the State Retirement Benefit Trust Fund. The selectmen appointed the town treasurer to be overseeing that. So the state, in 2013, we put in $1,200 $1,250,000. Total investment in, to date, from dollar to dollar is about $7,560,000. So that return is over the course of time.
Mr. Chairman,
Bill?
prior to that, the town's decision was to be in strictly fixed income instruments backed up by the U.S. government. So there was no floating net asset value, no equities, no variable return on the funds.
Thank you. Any further discussion?
If I may, Mr. Chairman,
Go ahead, Frank.
to Phil's point, OPEB and maybe some other funds, get special privileges. Generally, with municipal money, you can't run around putting it in things that aren't pretty much fixed returns. And one of the really huge benefits to this kind of a trust fund is that, in fact, we have the freedom to pick any investment strategy we'd like and garner the earnings. The PRIT or PRIM fund is a balanced fund that's about as aggressive as you'd probably want to get, because you really don't want to lose money. So that's one of the benefits to putting this OPEB program together. We take advantage of the laws that allow us to invest at an absolute minimum. And the other point I'd make is that all these earnings are tax-free because we're a municipality, so they're real.
Thanks, John. Frank.
Well, one other point, Mr. Chairman, is that anytime you're in floating net asset value, it's inevitable that you're going to take a hit on these things. So, keep that in mind sometime down the road when Gary tells us we got a 15-18% loss in these funds.
Yeah, and not to overspeak here, but that's the whole point of picking a discount rate of something like, 7 point something percent. Siegel constantly warns us, to Phil's point, that don't get too excited about 1 or 2 years, because you can get plenty of hurt. And once you're in the hurt locker, it's tough to get out, especially if you get whacked on the back end of the program. So we think the discount rate we're using, we'll review this again. I honestly, and John's work is terrific. If from 2013 historically we're at 8.8, that's great. I seriously doubt we would ever put the model at 8.8, just because we don't want to take the risk. We want to keep our payments strong enough that we know where our end game is likely to come in and track to that. But so you take a big win when you get it. But as Phil says, over a 25-year period, you can have some pretty dire years as well.
Yeah, and March of last year was particularly a troublesome time. Luckily, we recovered extremely well, maybe too well. We'll find out. Gary.
Just to also talk about that, the 10-year expected return that Prim uses is only around 6%. So there, as Phil talks about the ebbs and flows, when it comes time, if I have to talk about a 15% decrease, I'm going to have John Denizio mention that instead.
Smart move, Gary.
I see him lined up already for that. Roger.
Oh, just a quick recall. The last time that we got the update from Siegel Consulting in this report that we're getting a page out of, they had reduced the discount rate.
I think it's 7, if I remember correctly, we reduced it to 7.25.
That's correct.
Right. It used to be higher. So expectations have been going down.
Yeah.
It was a half a point.
Okay. Any further discussion? Chair will entertain a motion.
Motion to approve?
Thank you, John.
Second, Mr. Chairman.
Thank you, Sonia. Brad?
Yes.
Cody? Cody? I see a yes. David?
Yes.
Doug?
Yeah.
Frank?
Yes.
Is that a yes, Frank?
Yes.
John?
Yes.
Jaya?
Yes.
Ellie,
Yes.
Mike,
I thought Frank was going to vote no on OPEB. That would have been good. I'll vote yes.
excellent. Phil,
Yes.
Rob,
Yes.
Roger,
Yes.
Sonia,
Yes.
Tom,
Yes.
and chair votes aye. Thank you very much. That is OPEB. Now we're on to MIS.
Mr. Chair, if I may,
Gary,
I'd like to thank the committee for going through these budgets this evening. Being an old Ways and Means member, I did it for about 5 or 6 years. I think the only person in this crowd that probably presented when I was a member of Ways and Means was Phil Gallagher. And so I know the difficulty and the time and effort you put in, especially through this time period. So I just want to thank you. And
thank you, Gary.
Gary, are you leaving?
I am.
I have one question for you before you go relative to MIS. Have we had any fraudulent ACH or wire attacks in your department since you've taken over?
No, we have not.
Thank you.
Thank you, Gary.
Right.
Brad, MIS?
Yes, thank you, Mr. Chairman. So Tom and I spoke with MIS today. They're bringing in a budget of $667,455 for a 2.06% increase. The major drivers, this is not typical. Most of the Town Hall 2 budgets have primarily been driven by salaries, so a non-trivial one this evening. There are two areas of particular increase. One is the town has switched website vendors, and this was not a decision made wholly through MIS. This was in conjunction with the town clerk's office and various departments around town. It was agreed that they wanted more and better service, so that the cost went from $3,000 a year to almost $11,000. And then the other driver in their budget was an increase in the usage and corresponding licensing fees for, you may be familiar with the Viewpoint software. I believe Amy Warfield spearheaded that a number of years ago. It is software and services to allow initially the building department to fill out forms over laptops or iPads, and then have the documents available across departments. That was a bump of almost $7,000. But again, it's a service that many of the departments in town have found quite useful, and MIS has taken it upon themselves to manage all of that. Tom and I voted 2-0 to support their budget.
Thank you, Brad. Jose, welcome. Thank you for being patient and waiting through all the OPEB and unemployment and other discussion. Would you like to
Thank you.
add any comment?
No, I think Mr. Brandon did all the talk.
Awesome. Any discussion amongst the committee? Looks like we've gone silent for a little bit, and Chair will entertain, Phil.
Yeah, I have basically the same question for Jose relative to ransomware attacks. I think since 2017, there's been somewhere near the 4,000 ransomware attacks on major corporations and municipalities. I think there was 71 last year. And I'm wondering, are we getting any of those? And do you log any attacks on the system that might be construed as a ransomware attack?
No, we have not.
We haven't had any, or we don't log them?
Oh no, we do log them, yeah, but no attacks has been so far. And if you allow me to say, I would add that thank you to all of you for supporting us on this initiative that we started last year on revamping the hardware and also getting new security solution. It really has helped much better our infrastructure to prevent things like you just mentioned.
Thank you, Jose. Thank you, Mr. Chairman.
I also point out that the ISAC committee has been reformed as a permanent committee and has been talking a lot about cybersecurity and things that the town can potentially be doing better. We've been working through a draft and we're starting the initial process of just getting some feedback so we can iterate and make the town more secure. But that's currently a work in progress.
Mr. Chair, can I just add a quick comment on top? Oh, see, and Roger raised his hand. I have to start raising my hand.
You're already speaking.
Go ahead, Kelly, and then Roger, and then Phil, and then Rob. I maybe I should have kept my mouth shut. Sorry.
Just to follow up on that point, I will just toss this out there that I would, and maybe Paul can comment on this, but I would hope that a cyber security policy would be part of our property and casualty insurance portfolio.
I'm going to actually defer to Whitney on this. I know we talked about it a couple of years ago when they started offering
Yeah.
it. Whitney, can you confirm that, please?
Hi, yes, this is Whitney here. We do have cybersecurity coverage as part of our policy.
Okay, good. Thanks.
Thank you, Whitney. Now I can't remember the order. Roger.
This is probably an ill-placed question. I've actually been, about the website upgrade, I've been less than happy about it because I used to know where to find things on the website and now I can't. And some of them aren't even there, but this is probably not a question for Jose. But
Yeah, I know looking for agendas, I have a problem downloading them. It seems like a couple of clicks too many, but that's for another day.
yes, at least 3 too many.
Yes, Rob.
Yeah, I keep forgetting to ask this. Do we have any dedicated denial of service attacks where they try to overwhelm us, which is common?
No.
Okay, I won't try it.
Okay.
I don't think your laptop's powerful enough, Rob.
As a member of ISAC, I appreciate that. Phil.
Move to approve.
Thank you, Phil. Do I have a second?
Second.
Thank you, Roger. MIS, Brad.
Yes.
Cody. Was that yes? Thanks. David.
Yes.
Doug.
Yes.
Frank.
Yes.
John.
Yes.
Gaia.
Yes.
Kelly.
Yes.
Mike.
Yes.
Phil.
Yes.
Rob.
Yes.
Roger.
Yes.
Sonia.
Yes.
Tom. Chair votes aye 15-0. Next is
Thank you.
that was that. Did that just a point of order? Did that also include the capital budget items? Or?
That's capital improvements are a separate line item.
Yep, that's what I thought. So let's go through those.
Okay. Jose, are you set up to do your presentation?
Yes, I think I have it over here. Just give me 1 second.
So we are in the middle. We are in the second year of a 5-year plan. As Jose mentioned, there is a $1.5 million expenditure on improving our network hardware and $0.5 million toward improving network security. They actually have a success story just as of this week with the completion of the hardware rollout. Network security is progressing quite well. They've broken up this approximately $2 million cost, and this is I should know this, the third such expenditure that we've had, but it's a 5-year zero interest loan. The payment this year is $400,000. And we voted 2-0 to support. And Jose has more details with a presentation he has prepared for us. So Jose.
Hi. Can you hear me?
Yes.
Yeah.
Thank you. Sorry, it's not going to be the third, but it's going to be the second year of the payment. I think that you say something about the third. So yes, if you remember from last year, we had two projects. One was the 5-year network infrastructure, which includes all the hardware, and then we had the security solution. The first one was $1,477,533, and the second one was $517,571. So if you add both of them, you will be pretty close to the $2 million, which divided by 5, then that's when we come with the $400,000 a year. On the first part, which is the network infrastructure, we have completed that 100%. We replaced all the switches that we had, 2 telephones, core network, and also components for the voice over IP. Also, we installed new wireless in all the premises in the town and the schools, 440 to be precise. We also renew for 5 more years equipment that didn't need to be replaced at this time right now. So everything is with warranty for 5 more years. On the enterprise security solution, we are 50% right now, if we want to be precise, on accomplishing this task. So we apply what is called the cloud delivery security to all endpoints, or PCs, if you want to put it that way. We also install the advanced malware protection, which is called also antivirus, on all the PCs again and servers in the premises. We right now are in the process of installing secure email software in addition to whatever is over there, and also the cloud access security broker. We also going to be implementing the multi-factor authentication, and we are almost done with the new next generation firewalls for facilities in town and schools. And I think this is it.
Thanks, Jose. Are there questions from the committee?
Steve?
Yes, Frank.
This is Frank. Jose, on the security side, I'm assuming that there are many vendors involved in supplying the components. Is there a lead vendor of our security solution and upgrades?
Jose?
Is it something I said, Jose?
It looks like
he's not. He's muted. You're muted, Jose. There you go.
Oh, I'm sorry. Could you repeat the question?
Sure. On all of the security work that we're doing, there are a lot of pieces. There's cloud pieces, there's mail pieces, there's endpoint stuff. Is there one lead vendor for all of this, or are you piecing it together with lots of different vendors, or what?
We have one vendor for that.
And who is it?
E+.
Again, please?
E+. Letter E plus sign.
Okay. All right.
They are a large retailer in the state for Cisco equipment.
And are they oriented around municipalities or just commercial infrastructure in general?
Commercial, educational, also government, all.
Okay. And I assume we're applying this unilaterally to all departments, including schools?
Yes, we are.
Thank you.
Yep.
Thank you, Frank. Mr. Eiler.
Thank you, Mr. Chair. Just as an aside, if people don't have their chat open, Kelly sent something for a pointer. Jose, I just had a question. For employees that, I assume there's employees that are connecting with their own devices into our network. Well, I guess the question one, is that allowed? And if it is, what do we do for security on those devices?
Jose.
Yes, thank you. what we have done is separated the networks. So when you bring a device that is owned by the school or is owned by the town, goes on what we call a private network that is secure. Your devices are also protected. If you bring your own device, or if you want to go, let's say, on the guest network, you are totally isolated from our internal network.
Okay, that's great. So in particular, do we not support people coming in on a VPN from their private device?
Jose.
Yes, that we are supporting, but we are first securing, making sure that they comply with the latest viruses before they're coming into the premises.
Great. Sounds like you're doing it just right. Thank you.
Thanks, John.
You're
Thanks, Jose. Rob, did you have
Mhm.
another question, or you are all set?
All set.
Okay, great.
I didn't want to get too technical.
Sure. We'll save that for another meeting. Roger.
Oh, just, I guess as a follow-up on the previous question about VPN, with a lot of people working from home, I'm assuming that they're using VPN and either town provided or their own laptops to log into systems. How's that going?
Do you want
I'm going to jump in on that one. This is Joe from the IT department. I'm here with Jose. Currently, we have two options. People can get in with their town-owned devices, and they have a certificate that's issued by us that's directly on their computer, and they have access in. There's another option that's a portal option that we're actually going to be closing up as we go to the new firewalls. But currently, you could use any device, and you're basically coming in through a window, almost like any other portal you come in. And then once you go through that portal, then you get to your desktop that's actually on the inside. So you can use your own personal machine, but all you're using is the web browser to basically remote connect. So there are currently two methods for people to VPN in. But we do not allow, people do not put VPN certificates on their personal devices. That is not what we're doing on the town side.
Okay, thanks.
Thanks, Roger. Paul.
Yeah, I just wanted to add for the committee, I mean, the employees have been back to work since the governor let everybody back in the building. So if we have folks working from home, it's typically on a short-term basis if they're under Board of Health quarantine or for some reason, and they're not ill and they're still able to participate at work. We have some laptops like that. So I just wanted to clarify that aspect for the committee.
Thanks, Paul. Any further questions? If not, Chair will entertain a motion.
Move to approve.
Thank you, Roger.
Second.
Thank you, John. Brad?
Yes.
Cody?
Yes.
David?
Yes.
Doug?
Yes.
Frank? Frank?
I seem to be having problems. Yes.
Thank you. John?
Yes.
Jaya?
Yes.
Kelly?
Yes.
Mike?
Yes.
Phil?
Yes.
Rob?
Yes.
Roger?
Yes.
Sonia?
Yes.
Tom? I didn't. Yes, and chair votes aye, 15-0. Thank you. We'll
Yes,
move
thank you,
on.
Jose. Thank you, Joe.
Thank you, guys.
Thank you.
We'll go on to building inspector.
Thank you, Mr. Chair. So we're actually welcoming a new department head this evening, Mark Duple. He's joined the town as of November, I believe, sir.
Yes, that's correct.
Yes, he was previously in Foxborough, so welcome. I've tried to flesh out the budget process for him, and so this is stage 2. Okay. So with the building department budget this year, everything's level funded except there was a nuance with the salary line item. this year. So you may recall when building was going crazy a few years or so ago, we added another building inspector to the department. It was 3, maybe 4 years or so ago. Well, obviously there's been some slowdown. There was actually a retirement, an open position over in the department. We last year, in order to the way they were able to shave their budget for fiscal year 21 was to not fill that position for the remainder of the year. Well, moving forward, since we're still though we're all hopeful that the economy will be back and doing great by the end of the year. Again, municipal finances, municipal economy tends to lag the general economy. So the decision was made to continue to not get rid of the position, but hold it open for now. So there's a cost savings there. But just in case things pick up in the short term, the overtime budget was funded by an additional $39,000. And again, expectations are that money probably won't be needed. It would be returned to the general fund at the end of the year, but it's still a cost savings overall in their budget of $44,000 total. So that made sense to us, and Tom and I voted 2-0 to support that move.
Thank you, Brad. Mark, welcome. Would you like to add any additional comments?
No, I think Brad summed it up pretty neatly.
Awesome. Phil, I see your hand going up and down.
Yes, thank you, Mr. Chairman. Just a general question, Mark. How much experience did you have on the Gillette project?
None. The Gillette project was done years ago before I was in Foxborough.
I mean, the additional.
They're doing different projects now, but the initial build was years ago, obviously.
No, I meant the entire project, the build out of the Gillette place, etc. Were you involved in that?
No. There's constant remodel and tenant fit ups inside there, but not the total build out from the base.
Thank you. Just a general question, Mr. Chairman. Welcome aboard, Mark.
Yeah, we don't have any stadium style structures in this town. Ours is quite our one stadium is quite smaller. John.
Thank you, Mr. Chair, and welcome, Mark. I have sort of a general question, but I'll ask you because it came up in the context of your budget. I see there's an allowance for 5 weeks vacation for the inspectors and so on. What I'm wondering is what is the general accrual rate, and maybe this is a question for Paul or John. What's the general accrual rate for vacation, and is it capped at a maximum so that we don't have huge balances in vacation?
I would think Whitney or Paul.
No, Mr. Chairman, in general, new employee starts with 2 weeks, goes to 3 weeks after approximately 5 years. And then it ramps up an additional 5, but the maximum is 5 weeks. And there are different provisions in each of the contracts that I believe you can only carry over for vacation 1.5 years allotment. So by the end of the year, you have to have 1.5. So if you get 5 weeks a year, you could have 7.5 weeks on the books at the end of the year.
Okay, so we can't have a huge accrued liability there.
No, almost all of the contracts address it, and I think all the contracts actually address it, and it's monitored very closely so that employees know that they call it use it or lose it time. So they get informed well in advance so that they can make proper arrangements to utilize that time. In rare instances, we've granted somebody an additional month or 2 if something was missed to actually utilize the actual time and get back into compliance with to what the rules are.
Great, thank you, Paul.
Great. Any other questions? Okay.
Chairman, motion to approve.
Thank you, Sonia.
Second.
Thank you, Roger. Brad.
Yes.
Cody.
Yes.
David,
Yes.
Doug, Frank,
Yes.
John,
Yes.
Jaya,
Yes.
Kelly,
Yes.
Mike,
Yes.
Phil,
Yes.
Rob,
Yes.
Rob,
Yes.
Roger,
Yes.
Sonia,
Yes.
Tom,
Yes.
and chair votes aye. If I counted correctly, 15-0. We're gonna get Chris going, so we'll do veterans and disabilities, and we'll come back to sealers.
Thank you.
Thank you, Mark. Welcome aboard.
Nice to meet you.
Yes, thank you, Mark.
Thank you.
We'll try to get a stadium project for you. Hi, Chris. Sorry to keep you waiting.
Okay.
Thank
I
you for
lucked out in the
being patient.
selectmen's meeting.
What's that?
I lucked out in the selectmen's meeting.
Oh, all right.
I went first, so.
It balances. So Tom and I met with Chris on his budget this year. Well, I want to thank him for really cutting his budget down. He brought his budget in at 0.76%. So again, rather than level fund, he actually on the other items he actually shaved them down, and we appreciate that. That alone should have earned you an earlier spot in the agenda. But Tom and I voted. Oh, and I'm sorry. The total amount was $256,698. Again, for a 0.76% increase. Tom and I voted 2-0 to support.
Chris, welcome. Do you have further comment that you'd like to add?
No, I'm all set. Thank you.
Okay, great. Any questions from the committee?
Just a quick one, Mr. Chair.
Go ahead, Tom.
Have you contacted your grandmother yet?
I'll call her right now and tell her you said it's okay.
Thanks.
I just had a quick question around the, being a Boy Scout leader, I have fond recollections of going to many Veterans Day and Memorial Day ceremonies. Do you think we'll have something live again this year, or?
If I had my way, it would have been live the entire time, but apparently we got guidelines that we have to follow. So
Okay.
I've also been told that I can't just do things and then ask for forgiveness later. So
All right.
I'm hoping Memorial Day will be different, like thousands of people out there.
I do too. All right. Any other questions? Chair will entertain a motion.
So moved.
Thank you, Tom. Thank you, Roger. Brad?
Yes.
Cody?
Yes.
David?
Yes.
Doug? Yeah. Frank?
Yes.
John?
Yes.
Jaya?
Yes.
Kelly?
Yes.
Kelly left. Or Kelly?
No,
I didn't leave. No, I said yes.
Oh, I didn't hear you. Mike?
Yep.
I looked up, but you weren't in the usual spot. Phil?
Yes.
Rob?
Yes.
Roger?
Yes.
Sonia?
Yes.
Feel like a drill sergeant. Tom?
Yes.
And chairman votes aye, 15-0. Disability.
Yes, thank you, Mr. Chair. So we also spoke with Chris on the disability budget. It's funded at $934. That was shaved a bit, so it's coming in at a decrease of 0.85%. Chris explained to us that the recording secretary has gotten much more efficient at writing up the minutes, hence the reduction in salary. So Tom and I voted 2-0 to support.
Great, thanks. Chris, anything else that sums it up?
Yeah, I mean, Jen's a Navy veteran herself. So in the military, when you become more proficient, normally, more work is added on and you get paid, the same amount. So she's used to it.
Okay. All right. Any further comments from the committee? Chair will entertain a motion.
Motion to approve.
Thank you, John.
Second.
Thank you, Roger. Brad,
Yes.
Cody,
Yes.
David,
Yes.
Doug, Frank,
Yes.
John,
Yes.
Jaya,
Yes.
Kelly,
Yes.
Mike,
Yes.
Phil,
Yes.
Rob,
Yes.
Roger,
Yes.
Sonia,
Yes.
Tom,
Yes.
and chair votes aye. Thank you, Chris. 15-0.
Thank you. Have a good evening.
Thanks, Chris.
Thank you.
Thanks, Chris.
Last but not least, the budget we've been waiting for, sealers and weight.
All right. So
So,
let me step us through this here. So long ago, we moved to a flat rate contract. Oh, yep. I'm good.
Sorry, Brad. Go ahead.
go ahead.
Some few years ago, we went to a flat rate contract with the state of $15,000 a year for the sealer services. Some of that cost is offset by fees. The revolving account for that currently stands at around $21,000. We've been kicking in half for all these years, and I believe there's a $300 stipend for someone overseeing this whole account. So it's coming in at so there's been no change in what the state charges us. We reviewed fees within recent memory. Perhaps it's getting to be time to adjust them again, but otherwise it's the same as it has been for some time. They're coming in with no change in the amount of $7,800. Tom and I voted 2-0 to support.
Thanks. Any commentary from Whitney?
No comments, Mr. Chair.
Okay, thanks. Any discussion from the committee?
Question, Mr. Chairman.
Holy cow, I saw John, Roger, and then Frank. Sorry, Frank.
John?
Go ahead, John.
Thank you, Mr. Chair. Hot topic. I understand part of this is funded through revolving and part is through the operating budget. I can't recall. Did you say it's a 50-50 split, Brad, or how is that split between the two?
Yes, that's correct. It's 7,500 operating, 7,500 revolving, makes up 15,000 total.
Great.
And just like the other count, that all gets kicked into the revolving. So the income from different sources into the single payout source. Yes.
Okay. Thank you. And just to follow up on that, so I understand we outsource this to the state. Who actually deals with the state and make sure they're doing what they're supposed to be doing? Who's in charge of them?
Mr. Chair, I can answer that for you.
Oh, sure. Go ahead.
Okay, so we have a contract with the state to do the service of the measuring. We do the invoicing in-house, so there's an employee in the treasurer's office who does the invoicing and checks all that and receives the payments. So there's a list that they track.
Great. Okay. So just wanted to make sure someone's paying attention to what they're doing. Thank you, Whitney.
Okay, Roger.
Just seeing a balance in the revolving account that exceeds the annual cost. Does this account ever turn back money to the general fund at the end of the year?
Whitney. Or Paul. I see Paul's hand.
Yeah, that's a good question, Roger. What we're definitely afraid of is we've been paying the same contract amount since we implemented the program, and the state keeps threatening to increase it because they constantly tell us how much money they're losing on us, just given how much activity we have here in town with all the stores and all the scales compared to some of their other customers. So they were actively recruiting people at the time. They made us a sweetheart deal, and we've been still getting that sweetheart deal, but we are thinking that they may wise up at some point, and we may have to adjust that.
Well, let's not rock the boat.
And,
Go ahead, Roger.
and one follow-up. Like many accounts have a maximum that can be carried over. Is there a maximum on this one?
Whitney?
I could take that if you want. Yes, there is,
Oh,
Roger. It's $20,000 at the end of the year, and anything over that just gets turned back to the general fund.
Okay, thanks.
Frank?
The question I had, thank you, Steve, is setting the rates. Is it completely up to the town's discretion to set the rates? Does anyone know?
John? Paul?
If I recall, Mr. Chairman, that there were certain of the functions that were governed by state law, and there were certain others that the town had a little bit of input in. And I think it's the largest group of revenue sources, which is the cash register readers, price reader kind of things that we really have an abundance of that's set by the state. And then the things that we have less of, sort of like the gas pumps and the scales and measures, we have a little bit of flexibility on those. That's how I recall it.
So assuming that you've got that right, Paul, then we really don't have much to gain by trying to make a rate adjustment. There's not much we can change.
As I said, it would be modest, given that the largest portion of the devices that are measured are the actual scanner readers at your checkout counters, and that's where the biggest chunk of the activity is.
Yeah, okay, thank you.
Thanks. Any further questions? Yeah, we'll entertain a motion.
Move to approve.
Thanks, Roger.
Second.
Thanks, John. Brad?
Yes.
Cody?
Yes.
David?
Yes.
Doug? Frank?
Yes.
John?
Yes.
Jaya?
Yes.
Kelly?
Yes.
Mike?
Yes.
Bill?
Yes.
Rob?
Yes.
Roger?
Yes.
Sonia?
Yes.
Yes.
And chair votes aye, 15-0. I can't wait to get back and meet in the conference room where we can just raise hands again. That concludes the agenda for tonight. There's no minutes this week. Melinda, our recording clerk, lost someone, so she was unavailable to take the minutes. So our thoughts go out to her at this time. Next week, we'll be doing police, fire, emergency management, and also we'll be taking the town clerk at that time as well. Chair will entertain a motion unless there's other last minute comments.
So a point of order here. David, what have we got for a tentative date for the assessor?
April 7th.
Okay, and you're aware of that, Steve?
I am. I was actually going to ask if he actually confirmed it.
It is confirmed.
All right, so I will update the two agendas for next week, which has been on my radar since the beginning of the year, when Whitney sent out the revised schedule, and then David brought this up last week. So I'll get those two modified agendas on the town website for tomorrow. Anything else? Motion. Chair will entertain a motion.
Motion to adjourn.
Second.
Good night, everyone. I'm not calling names again.
Thanks.
Good night, everyone.
Good night, everybody.
Good night.